Hello, I'm Tony DeMaria, the editor of JACC, here with a discussion of the highlights of the best papers in the October 9th issue of JACC. One of the interesting papers we have in JACC deals with a comparison between fatty body mass and lean body mass, and inferentially deals with the obesity paradox in cardiovascular disease. Now, this obesity paradox has probably been overworked, but nevertheless, there's clear evidence that although obesity is associated with risk factors for virtually every type of cardiovascular disease, that once a patient develops disease, obesity can be protective. And this, of course, is a paradox that's been shown for coronary disease, for heart failure, for atrial fibrillation, for almost all conditions. And it's been a little bit perplexing, and part of the issue that's been raised is that the criteria for obesity has typically been body mass index. And so the investigators from the Ochsner Clinic in New Orleans set out to determine not only body mass index, but to subdivide it into fatty body mass and lean body mass, with the concept that lean body mass would probably be very important. And so they divided all of their cardiac patients into 4 categories: a combined low lean and fat body mass, a combined high lean and high fat body mass, and then 2 other categories in which one or the other types of body mass was increased but not the other. And what they found was that, in fact, if you had increased fatty body mass associated with increased lean body mass, that those patients had the lowest mortality. However, if you had both a low lean and fat body mass, that was the highest mortality. The 2 in-between categories were in fact also in between in terms of their overall mortality. So this is an interesting paper. It focuses importance not only on fat but also on lean body mass, the concept that an increased lean body mass may, in point of fact, identify patients who have more muscle, who are overall physiologically in a more superior state. It goes along with some data that's been presented in the past that body mass index taken into account with exertional capacity or physical fitness is very important. If you have high body mass and good physical fitness, that clearly is the best. Whether or not it will be worth it for all of us to do detailed measurements of lean body mass remains uncertain, but it does help provide some perspective on this perplexing problem of the obesity paradox. An interesting paper in this month's JACC deals with this interesting condition of inappropriate sinus tachycardia. Now, this is an unusual condition that's characterized both by palpitations as well as an inappropriate heart rate, either at rest or with early degrees of exercise that's out of proportion to the physiologic demands. And now many of these patients are young, and oftentimes they have additional symptoms to the palpitations that are relatively nonspecific. Nevertheless, this is a condition that's encountered from time to time and has been well described in the literature. And so in this month's JACC, we have the first randomized prospective clinical trial testing the efficacy of ivabradine in this group of patients. Now, it's believed that the mechanism of this inappropriate sinus tachycardia is an excess activity, more accelerated activity of the IF current that's responsible for the depolarization of the sinoatrial node. Ivabradine, of course, is an IF blocker, so it was logical to think that ivabradine would be the perfect therapy for this condition. And so, in fact, in this month's journal, the investigators managed to gather about 20 patients with inappropriate sinus tachycardia, and then they randomized them in a double-blind prospective crossover protocol to ivabradine versus placebo. What they observed, to no one's surprise, was that ivabradine was very efficacious. In fact, as compared to placebo, it reduced symptoms by over 70%. Now, it also reduced resting heart rate, exercise heart rate, and postural heart rate. But interestingly enough, the reduction in symptoms was not closely related to the reduction in heart rate, an interesting diversion there. Most of the patients did feel considerably better, and the investigators felt that ivabradine was extremely effective with low side effects. Of course, ivabradine is not yet available in the United States, but it's likely that it will be available in the future. And for this unusual group of patients with inappropriate sinus tachycardia, this may be the perfect therapy. I hope you agree that these highlights of the October 9th issue are very beneficial. For Inside JACC, I'm Tony DeMaria.